Okay, for tonight, we're going to talk a little bit about our facility, and we'll head back into the OR. So if you're a patient that comes and joins us, a big part of it is our team. The team that we have is really what we're most proud of, but for our team to have success, we need the proper tools. I am very excited about this facility that we're in, designed it from the ground up. It opened in 2008, so we've been here for 10 years. It's not particularly fancy. It's not particularly whiz-bang, but it has all of the technology, the space, the safety features that we need to provide quality care. I designed this with a healthcare architect who has great experience in building this type of facility. I visited a number of facilities before going about to looking for a site, a location, and design of our facility. And we're going to take a little bit of a look at that tonight. So as a patient, what you do is you come in, and if you join us for surgery, you come in from our reception area here on the left, our reception area. We do have a secondary OR here, and we're going to go into our main OR now. But when you come in, we've got just our general workspace, nursing station, medication storage, etc. And there are patient rooms. We have a private patient room that you come into for your markings, etc. But again, nothing particularly fancy in here. So our workstation area for our nurses, we do have overnight stay facility within our license where you can have monitored nursing care with IV medications, etc., and stay overnight in our surgical center. For our bigger cases, we use that on a pretty regular basis. Okay, let's take a walk back. Good night, Carly. She's sneaking out before she gets on camera. One of our nurses. So we've got our basic preparation area, warming cabinet for fluids, warming blankets. Warming is an important part of plastic surgery when you're exposed. So talk a little bit more about that, but we've got a lot of warming devices before surgery and in surgery itself so that we can keep patients warm through surgery. We have our sterile preparation area, scrub sink, the traditional scrub sink, although really data shows now that a lot of the dry rub is equally as effective, perhaps more effective, but we have both of those at our surgical prep station, then we head to the OR. So the team really is how we're able to do all of this. And Austin is a surgical tech. Haley is our other surgical tech. We have others we work with, but they're here on a full-time basis. Really, we did design this so that it would be also a very personal space that could be private and comfortable. And we are the team. We all work together on a regular basis, do the same procedures together on a regular basis. And we're in very close contact with our office space next door. And that seems to be a big advantage for us for convenience and big convenience for our patients as well. In our OR here, we've got significantly powerful heating and cooling systems that can quickly control the temperature. So there's specific on the roof of this building, HVAC control just for each OR. There's humidity control as well. There's high efficiency filtration of all the air, positive pressure airflow for infection control of that filtered air that goes above the OR table. So there's several outlets around the OR table, and each corner of the OR, and both of our ORs are set up this way where there is outflow of the air. That's to bring fresh air in and minimize infection. The separate walkway into the OR, all of those things are sort of technical things that are required and in a licensed surgical facility and that we have here. So all those backup and safety mechanisms are here, including advanced airway, video endoscopic airway intubation devices, emergency surgical airway devices. And we got to do drills because we don't see it on a regular basis, and that's where the staff that come in here are trained and generally have come from a critical care background for nursing, emergency, ICU, and otherwise, because we need to have that background and experience to work here together to have those capabilities, but we don't train that here because we don't see that on any kind of consistent basis or really at all. Most of this is process and policy and procedure that we really do go through so that we have a consistent way of approaching what we do. Our teamwork environment really supports that with the familiarity of working together. But we do have lab agreements if we need intraoperative labs, x-ray agreements if we need intraoperative x-ray, those type of things. In general, we don't need that. But those are other things that are part of our accreditation process and our backup procedures. We're going to wind it down for tonight. Please follow us as well on Snapchat, Instagram, Facebook at Denver Body Doc, our website, coloradoplasticsurgery.com. I'm Nick Slenkovich. We love to partner with patients on their self-improvement journey. Plastic surgery is never the destination. It can be part of the journey for some. For Nick, myself, Austin, Alex, Clayton, and Dan that are here tonight, as well as the rest of our team here at Colorado Plastic Surgery Center, thank you. Enjoy your journey and good night.